Hi, this video is the art of hair transplant restoration surgery result 1 year post-op with before and after photo by Dr. Diep. This client is a physician himself. He's a GI specialist and flying from a different state, and he has some opportunity to allow me to show the audience what his result looked like. He actually had a procedure done in the past. It was an FUE, but the surgeon was not the FUE specialist, so the surgeon didn't manually pull the hair graft himself. So he used a device to remove it himself. And of course, the density, because the device cannot give the most healthiest roots and thus have poor density. And on top of it, there's no artistry of his past surgery, so it doesn't look perfect. He didn't bring the temple. I'm glad this doctor reminded me to tell the audience that number one, he didn't put any topic or any product on the head. Number two, he want to focus on the temple, because otherwise the forehead looks too wide. And he actually went to see other physician, and it was because the temple is so difficult to work with that other clinic or surgeon won't do it, because it's very difficult. And for me, I'm a temple guy, and I focus heavily on the artistry of the hairline. So I spent many years trying to master how to work on the temple. And if you do it right, it will turn out really good. I mean, not everybody can have a perfect one, but if you focus on the symmetry of his, of not just vertically but horizontally as well. And you can see this is his real hair. And again, now he's being the client and the patient. He actually, after past surgery, he didn't feel really good about the results, so that's why he went to watch a lot of video, and it came upon my result. And of course, he was impressed with the result, but the thing is, he was a little bit skeptical because it looks too dense. And so, but thank you for being on the video, because he wanted to show the audience that hey, is the patient, he's on the other side, and it's real, and he's walking around with a real full set of hair. I'm going to show the audience what he looked like before. Again, this is from a different clinic, and the result of one procedure done with FUE, and the surgeon did not harvest the hair graft manually, so he has poor density. He uses some kind of device. With my work, I'm manually harvesting it one at a time. Harvesting the hair graft one at a time, it would take a lot of time, and it's quite technical skill. And when the surgeon can do that himself, the density tend to be there. Why? It's because the roots tend to be healthier. That's why they are known as FUE specialists. Again, for him, you can see the tiny mini plugs. It's hard to see, but it's there. And number two is poor density. And then I brought in his temple and I lowered the hairline a little bit to hide the mini plugs. And then to show the top view, there was a little poor density on top. And this is a year later with excellent density. No topics, no other chemical on it. And again, we brought his temple, poor density from the past surgery. We lower the hairline, and just to show the audience, that's poor density right there. See, and then 100% done by me, FUE, a year later. We did 3,053 grafts. And you can see that too, and a year later. All right, look at that, his hair now. And you can see we brought in his temple and lower the hairline. The temple is really important, because it really frames the face, enhance the eyes, the nose, and all the features that God created. And once you have full set of hair and frame the face better, your face will look completely different. Hey doc, can you turn face toward me? Perfect. And this is his real hair, and he looks so much younger. And I'm gonna comb through so the audience can see. There's no topic, there's no chemical, there's no stuff that high. This is all his real natural hair with real density, and you can see it has nice zigzag. I actually gave him a medium tight hairline, so that will give him the maximum density. And again, I'm known for a few. Number one is the FUE, being a FUE specialist. Number two is how natural the hairline, and that's why I have clients from England, France, and Asia, movie star from Asia, and even Bollywood actor as well. Why? The most important, because you don't want to be you know, to be seen and notice that there's a hair transplant done. What might work, no one will know. This client actually had I brought in at least 1 inch of his temple and lower his hairline. This is full density. And can you look down for me? Perfect. You see, excellent density. Go ahead, look up at me. This is the art of a hair transplant restoration surgery result.